Alright, okay, so hello dears, and welcome to the video on our laboratory procedure, which is your preparation of your thick and thin blood smears for the diagnosis of malaria and other blood parasites. Okay, so as always, before we start, we first present our materials needed. So of course, we have here first is spreader slides, which we use to prepare the smears, no, especially for the thin smears. Okay, and then you have here your pencil for labeling, and then you have the Pasteur pipette to get our sample, and again your sample in your purple top tube or EDTA tube, and of course the slides, our slides for the smears. All right, so after preparing your materials, our first thing to do, the first thing to do pala is, of course, we need to label your slides. Okay, so for this video, what we're going to present is the preparation of your thick smear on one slide, preparation of a thin smear on one slide, and a combined thick and thin smear in one slide. All right, so your sample is here. So it's Santos Maria with the birthday. Again, under normal circumstances, the sample of choice would have been your capillary blood, no, finger prick blood sample. But again, you can use still your venipuncture specimen. And if it's a venipuncture specimen or a specimen from a venipuncture, it should be placed in, of course, your EDTA tube or your purple top tube, because again, we don't want it to be coagulated, and again, we want to make smears. All right, okay, so for this purpose, for this video, so that we can prepare a lot of smears, we will use the EDTA, okay, the EDTA sample. All right, okay, so again, the first thing to do is, of course, label muna the slides. Okay, so now your slides have been labeled, of course, again, using your pencil. Okay, and you could also indicate what type of smear it is, but again, it would vary in each laboratory in their standard operating procedures, SOP, on how to label. So again, make sure to ask your laboratory and to follow your procedure. Okay, all right, so we'll first perform the thick smear. All right, okay, so we now get our sample using a Pasteur pipette. Okay, all right, now in your slide, you put about 1, 2, 3. Okay, 1, 3. All right, now using the end, okay, the end of another slide, it doesn't have to be a spreader slide, normal slide lang, we then mix the two, okay, enough to form a circle. Okay, again, the size of a 25 centavo coin, all right, or the size of a nickel. So again, we mix. All right, so I think that's it. Okay, again, it's quite big, but yeah, that's it. The size of a 25 centavo coin. Again, the size of a 25 centavo coin or the size of a nickel. All right, now after we mix, okay, the circle, and it becomes like this. So this is now your thick smear. We then let it dry, okay, air dry for a few minutes, and then after, we then let this be dehemoglobinized, okay, subject to dehemoglobinization using either distilled water, tap water, or the GEMSA solution itself, or a buffer solution. Okay, so we let this set muna at room temperature again to air dry. All right, so that's for your thick smear. So this is now your thick smear. Again, thick smear used for screening purposes. All right, so that's all for your thick smear. All right, okay, now we go now to your thin smears. Again, recall that your thin smears are used for species identification of your Plasmodium parasite, because again, it's through the thin smears that we can see the various morphological structures and forms of your Plasmodium. All right, that's why we can identify them up to the species level. All right, so for your thin smears for parasitology, again, it is prepared similarly to how you prepare your blood smears in hematology. Okay, so I'm sure you have already experienced that in your MT14, so review na lang. Okay, so again, prepare your slide, labeled slide, and then also this is my spreader slide. Okay, so again, similar to MT14, prepare your slide, okay, and get a sample. Again, just a drop at the end. Okay, All right, and then of course you have your own techniques. Okay, so this is one of my methods. All right, so all the way to the end, and then pull. Okay, ayan. All right, so this is now your smear, diba? So you can see it's tongue shaped. I love it. Okay, this is your tongue shaped smear. Okay, I'm not sure if it's clear ba. Okay, all right, and yeah, so this is now your thin smears. Okay, again, it should have a thin end, sorry, and your thick end. Okay, and we examine your Plasmodium species similar to your hematology here at the thin end. Okay, so again, we let this dry and then we stain this using Gemsa. Ayan, so this is your thin smears. Okay. For the next smear that we're going to perform, it's the combined thick and thin blood film. So the two films or the two smears are already on one slide. So it's really cost effective, no? And you're hitting two birds with one stone. So some of the hospitals really are performing this. And usually they get it from a finger prick blood sample. All right. So again, still the same labeled, no? All right. So the first thing that we will do is, again, we get our sample again. Let's assume that this came from a finger prick blood sample. So again, you don't need to put a lot. Okay, so this is for your thick smear on one end and another drop for your thin smear. Okay, so the first thing that to do is, of course, you make your thin smear. Okay, sige, ano na lang. Another method na of making your thin smear. Okay, all right, so that's your thin smear. And of course, the next thing to do is you get another slide and you mix your thick smear again until it becomes similar to a 25 centavo coin. Okay, all right. Okay, and that's your combined thick and thin films. Okay, so we let this dry again. Some usually will label this if it's a non-frosted slide, no, some will label it here at this one. When it's dry, they will label it here, okay, at the thick end, because again, you won't use that part. And some for the thick smear, what we're going to do is we're going to put a sticker, okay, with the label if they're using a non-frosted slide. But since we're using a frosted slide, okay, we have already labeled it. Okay, all right. And again, we let this dry and let it be stained. Okay, always remember that the first thing to do is we fix the thin smear with your methanol, and again, your thick smear should not be in contact with methanol. Okay, and afterwards we then let it stain. The dehemoglobinization of your thick smear can be performed using the Gemsa na, okay, in the stain mismo. All right, and then we examine first your thin smear, okay, and if it's negative, we then go to your thick smear, okay, to check if it's really there, all right, or if it's just low lang ba in number. Okay, so we first examine your thin smear. If it's negative, we go to thick smear, okay, because maybe in the thin smear, baka konti lang, maybe in little number lang, but in thick smear, you can see already it's concentrated there, so makita nimo tanan gyud if there's really a presence of Plasmodium ba or a parasite. Okay, so this is your combined thick and thin smear. Okay.